Hi family, hi family. This is Dr. Mo with Moya Body Care and Colon Hydrotherapy, and I am your favorite colon hydrotherapist that practices the sacred art of colon hydrotherapy, herbs, and natural living. This video is on a very touchy subject, two subjects. One is stroke survivors and those recovering from strokes. And then the second population are elders living by themselves, not necessarily in bad shape, but the self-care and hygiene could be giving a little bit more attention to be on more of the delicate words. So this week I experienced a significant amount of elders who need more self-care attention. For instance, the common denominator for all of them is insufficient blood flow from the knee to the foot. Complete insignificant blood flow, neuropathy, open wounds. Hear me when I tell you. I had an elder show up for their colon therapy appointment. Their pants leg lifted up a little bit, and I was able to see the ankle. And the ankle was swollen, and I was like, what's that? Can you pull your pants leg up? And they were very reluctant to pull the pants leg up, which made me peer even more into this situation. You will show me what the hell is going on with your leg. Now I'm not letting up. I was mortified at what I found. Mortified. An open wound. And I can tell that the wound had been trying to heal, but then it would get infected and then it would try to heal. Like I can tell by the way that the tissue, the color of the tissue, and like the texture. And so I started asking questions about, does anybody know about this wound? Anybody? Of course, the answer was no. Does a doctor or a physician or a nurse or a physician's assistant or a nurse's assistant, a medical professional, an acupuncturist, a chiropractor, a colon therapist outside of me, does any one of those professionals know about this wound? No. Okay. How long have you had this open wound on your leg and you have diabetes? Let me see here. I think, okay, that's past 5 days right there. I know what I need to know. So I immediately go back to my office. I get the items that I need to start cleaning the wound. Wound care is something that every practitioner should know. Regardless of what kind of practitioner you are, you should know how to clean an open wound. If you don't know how to clean an open wound, you might want to take one of my trainings because that information comes automatically with all of my trainings. So I proceed to clean the wound, and the client is in complete amazement. And I go, why are you so amazed and shocked and whatever? And they're like, oh, I just thought you were a colon therapist. And I was like, what the hell does that mean? What does that mean? If you have been to your medical professional office and they have not seen this or questioned why your ankles were swollen and looking discolored, I think you need to be questioning and being shocked about them and not shocked that I am trying to help you right now. Are you fucking kidding me? proceeded to clean this person's leg. And something said, after I bandaged up, now this is like, we're 45 minutes into their colonic session. It took me 45 minutes just to clean and properly bandage this open wound on an elder diabetic leg. When I tell you the level of insanity that created in my head, like, I just don't. So, I went. I did ask for permission to look at the other leg. And they reluctantly showed me the other leg. And what I find on the other leg is, if this is your foot and these are your toes, I go to start massaging the feet, the toes, the person shoots straight up to the roof. So I drop their foot and I'm like, what? What's the matter? And they're like, it's painful. Why is this pain? So I lift the foot up to look at the bottom of the foot. The toes had fused together. So their skin okay. So I proceed to go get the castor oil and I start massaging to break up the skin so I can separate the toes and then get into that and then start cleaning those wounds because those are open wounds. My message is this. What is my message? What is my message? If you have elders in your life, check their feet. It takes 2 minutes to just foot care. 2 minutes every day. 2 minutes every day. No wonder my client was tiptoeing into my office. I'm like, why are you walking like that? What is the issue? That was why. Now imagine if I didn't take my time to clean and look and see and assess. What would have happened? Oh, I don't even want to think about it. I'm just nauseous. And the smell from the bacteria from the feet. Yeah. It's glorious. If you are touching people, it is your due diligence to be of service to your clients. And if you are not doing that, you need to get out the game. I don't tell people what to do often, but I'm going to tell you that. Get out the game if you're not trying to do it at that level. Just move out the way because we don't need you. You in the way. You ain't helping. Clearly, all of his practitioners ain't helping. The hell? If you are unable to do it, bring your elder to me. I will do it. $50 flat rate. Just bring the client to me. I will take care of it. Bring the client. Bring your elder. Bring your mother, bring your father, bring your aunt. I'll do it. It's not a big deal. I'm going to calm down. I'm going to calm down. Anyway, the client walked out happy, and that client has a standing appointment with me once a week, and we're going to do a customized herbal foot soak. I'm going to clean the wound, we bandage it up, check it, monitor it, and we're going to do that once a week, every week until it closes completely. Yeah, and that's just a flat rate, $50. So if you have elders that need some care like that, like some self-care, I can do it. It is not a big deal. Like, really is not. It takes me 2 seconds. I'm extremely good at it. I'm just going to go ahead and say I don't talk about this often, but my father passed away in 1996 from skin cancer. And there was a moment where he had open wounds all over his body. And so my sister, my mother, and I rotated with tending to his wounds, right? Because it is an emotional situation and you do get emotional with caring for your loved one. And so at that time, I was in high school. I was in 11th, 12th grade. So at that time, I'm assisting my father with closing wounds up when they open. And when they open, when you have skin cancer, it's not like a cut. It's undescribable how the body pushes waste out. It is undescribable. So to keep that clean, you have to have a certain level of, I'm just going to go ahead and say it, detachment emotionally, but enough attachment to carefully clean and clear and care for this wound so that the person can heal. And then once it closes, then you can reattach yourself, because if you attach yourself while you're doing that, you're going to break down and you're not going to be able to be of service to that person. So this is the reason why I say I am the best person for this. I'm 47 now, so I have cleaned and closed a lot of wounds. I don't talk about this aspect of my business so often, because it's not something that I offer. People just land in my office and they just have an open wound, and I'm like, what the hell is this? And it just happens. And I clean it and I close it up, and they're like, oh, thank you. And they go back out into the world, and they either tip me very well or they buy a large package or whatever, however they feel to reciprocate. But it's not something that is on my services list. But if your elder needs attention in that way, we can set up a weekly standing appointment is what I'm trying to say. I'm trying to be as delicate as possible with my wording. And then, keep in mind that I'm not a medical doctor. I'm a metaphysical doctor. Those are two totally different things, but I completely know how the body heals under a cellular structure as a colon therapist. Completely understand that. So with that understanding and your trust in that, definitely first seek your medical professional first. And this is by no way or any means necessary trying to trump what a medical doctor would say to you. I'm just simply saying, if you need some assistance, I can help educate you on how to care for your elder. Okay, my name is Dr. Mo with Moya Body Care and Colon Hydrotherapy, and I'm your favorite colon hydrotherapist that practices the sacred art of colon hydrotherapy, herbs, and natural living. My private office is located in Torrance, California, and my website is moyabodycare.com, and my phone number is 562-682-0818. Until then, stay magical.